Dr. William Mercer.
Sudden numbness on one side? Why your skin is acting drunk. Have you ever brushed your hand across your arm and paused because something didn't feel quite right? Not pain, not weakness, just a strange numbness. Almost as if one side of your body had fallen asleep without any reason. Maybe your cheek felt different while washing your face. Maybe one hand suddenly seemed wrapped in an invisible glove. Or perhaps your leg felt oddly disconnected, as though your skin belonged to someone else. Many people shrug it off. They blame a pinched nerve. They assume they slept in a bad position. Some even laugh and say, "My arm must be acting drunk today." But what if that strange feeling isn't coming from your skin at all? What if your skin is simply delivering an emergency message from your brain? Today, I want to talk about one of the most overlooked warning signs in medicine: sudden numbness on one side of the body. Not both sides, not gradual tingling that has been there for months, but a sudden change affecting only the left side or only the right. This is one of those symptoms that experienced neurologists never ignore. Because while many people assume numbness is a problem with nerves in the arm or leg, sudden numbness affecting one entire side often points somewhere much higher: the brain. And when the brain is involved, every minute matters. The frightening part is that numbness often arrives quietly. There's no dramatic collapse, no severe pain, no loud alarm, just an odd sensation, a feeling that's difficult to describe. Patients often tell me, "It just felt different." I couldn't explain it. My skin felt thick. It wasn't completely numb. It just didn't feel normal. Those words matter. Because the brain doesn't always shout when something is wrong. Sometimes it whispers first, and recognizing that whisper can save a life. Let me introduce you to someone we'll call Margaret. Margaret was 72. She loved gardening. Every morning she stepped outside with a cup of coffee before the summer heat arrived. One Tuesday morning, while picking tomatoes, she noticed something unusual. As the leaves brushed against her left forearm, they didn't feel the same. The sensation seemed dull, muted. She rubbed her arm with her other hand. Still strange. She checked for insect bites. Nothing. She flexed her fingers. Everything moved normally. She wasn't in pain. She wasn't dizzy, so she kept gardening. An hour later, she noticed the left side of her cheek also felt different while wiping away sweat. Still no pain, still no weakness, still no panic. By lunchtime, her daughter called. Margaret casually mentioned, "I think I slept funny. Half my skin feels weird." Her daughter immediately drove over. Within another hour, Margaret developed slightly slurred speech. At the hospital, doctors confirmed she was having a stroke. Fortunately, she arrived in time for treatment. Her recovery was remarkably good. But later, she said something that stayed with me. "I wish I'd known numbness alone could be the first warning." That sentence deserves to be heard by millions of people. Because many strokes don't begin the way television portrays them. Not everyone collapses. Not everyone grabs their chest. Not everyone loses consciousness. Some people simply notice that one side of their body suddenly doesn't feel quite right. To understand why this happens, imagine your brain as the world's most advanced electrical control center. Every touch, every temperature, every gentle breeze against your skin, every hug, every drop of rain, travels through an incredible communication network before you become aware of it. Your skin contains tiny sensors constantly collecting information. These signals travel through nerves. They enter the spinal cord. Then they travel upward into specific parts of the brain that interpret what your body is feeling. Think of it like a postal system. Your skin writes the letter. Your nerves deliver it. Your brain opens the envelope and understands the message. If the delivery route is interrupted near your hand, perhaps because of a compressed nerve, only a small neighborhood loses service. Maybe one finger becomes numb. or part of the hand tingles, that's common. But if the interruption happens inside the brain itself, suddenly entire regions of sensation can disappear together. The arm, the face, the leg, sometimes all on the same side. The skin hasn't failed. The brain simply isn't receiving or correctly processing the message anymore. That's why sudden numbness affecting one side deserves immediate attention. It's less about the skin and much more about what the brain is trying to tell you. One of the biggest misconceptions I hear is this: if I can still move my arm, it can't be a stroke. Unfortunately, that isn't true. The brain has different regions responsible for different jobs. Some areas control movement, others process sensation, others help produce speech, others coordinate balance. A stroke affecting one area may spare another, so someone may have perfectly normal strength but lose normal sensation. Someone else may speak clearly but suddenly lose coordination. Another person may experience vision changes before any weakness develops. Our brains are wonderfully organized, but that also means symptoms depend entirely on which small area loses blood flow. This is why sudden numbness should never be judged by itself as not serious. Instead, it should always be viewed in context. Did it come on suddenly? Is it only on one side? Is it affecting the face, arm, or leg? Is it accompanied by trouble speaking, difficulty walking, confusion, vision changes, a severe headache unlike anything you've experienced before? Each additional symptom raises concern even further. But here's something many people don't realize. Sometimes numbness comes first. The other symptoms don't appear until minutes or even hours later. That window matters because strokes are, at their core, problems with blood flow. The brain depends on a constant supply of oxygen and nutrients delivered every second of every day. Unlike many other tissues in the body, brain cells cannot tolerate long interruptions. Imagine turning off electricity to a city. At first, lights flicker. Then traffic signals fail. Communication breaks down. Eventually, entire neighborhoods stop functioning. The same thing can happen inside the brain when blood flow suddenly decreases or stops. Certain brain cells begin malfunctioning almost immediately. Their first message may simply be altered sensation, that strange feeling in the skin, that odd numbness, that peculiar disconnect patients struggle to describe. It's not the skin behaving strangely. It's the brain struggling to interpret the signals arriving from it. And that's why saying your skin is acting drunk is actually more accurate than people realize. The problem isn't usually the skin itself. It's the control center interpreting what the skin is reporting. There is another condition worth mentioning because it often causes confusion. A transient ischemic attack, often called a mini-stroke. Despite the nickname, there is nothing minor about it. Symptoms may disappear within minutes or hours. The numbness may completely resolve. Speech may return to normal. Everything may seem fine again. Many people breathe a sigh of relief and never seek medical attention. That can be a dangerous mistake. A transient ischemic attack is often the body's final warning before a larger stroke occurs. Think of it as a brief interruption in blood flow that resolves before permanent damage develops. The symptoms disappear, but the risk remains. It is an opportunity to investigate why the interruption happened in the first place. Ignoring it is a little like smelling smoke in your home, watching it disappear and deciding not to check where it came from. The absence of smoke doesn't guarantee the danger has passed. The same principle applies here. When sudden one-sided numbness appears, even if it goes away, it deserves urgent medical evaluation. Because identifying the cause early may prevent something far more serious later. One of the reasons people dismiss numbness is because they have experienced harmless tingling before. Perhaps they sat with their legs crossed too long. Perhaps they leaned on an elbow while reading. Perhaps they woke up with an arm that had fallen asleep. Those situations are common, and they happen because pressure temporarily interrupts the normal function of a nerve. Once the pressure is relieved, sensation gradually returns. You may even notice the familiar pins and needles feeling as the nerve begins working normally again. That is very different from sudden numbness caused by a problem inside the brain. The difference isn't always dramatic. In fact, that's exactly what makes it dangerous. A compressed nerve usually affects a specific area supplied by that nerve. Maybe the thumb and first two fingers, maybe the outside of the foot, maybe a patch of skin near the elbow. The pattern is often limited and follows the anatomy of that particular nerve. Brain-related numbness, however, often ignores those neat boundaries. Instead, it may involve the entire side of the face, the whole arm, the entire leg, or several of those areas together. It's as though an invisible line has been drawn straight down the middle of the body. One side feels normal, the other suddenly doesn't. Neurologists pay very close attention to these patterns because they provide valuable clues about where the problem may be occurring. Your body is constantly giving information. The challenge is learning how to listen. Another reason this symptom is overlooked is that numbness isn't always complete. People often imagine numbness as the total absence of feeling, but that's not how patients usually describe it. Instead, they use phrases like, "My skin felt thick. It felt fuzzy. It was like wearing an extra layer. It felt swollen, even though it wasn't. My face didn't feel like my face. I could feel touch, but it felt wrong." Those descriptions may sound vague, but in neurology, vague does not mean unimportant. The brain processes incredibly detailed sensory information. When that processing changes, people often struggle to find the right words, and that's perfectly understandable. Imagine trying to explain the exact difference between warm water that's comfortable and warm water that's slightly too cool. You know they're different. But describing the sensation precisely isn't easy. The same is true for altered sensation. Patients often know something has changed long before they can explain it. That's why it's important to trust sudden changes that have no obvious explanation, especially when they affect only one side. Now let's talk about another patient. We'll call him Robert. Robert was 68 and enjoyed taking long morning walks with his dog. One autumn morning, he noticed something odd. The leash didn't feel quite right in his left hand. He looked down to make sure he was holding it properly. He was. He switched the leash to his right hand. Everything felt normal. He switched it back. Again, something seemed off. No pain, no weakness. Just an unfamiliar sensation. He considered finishing his usual 3-mile walk. Instead, he remembered hearing that sudden one-sided symptoms should never be ignored. He went directly to the emergency department. Tests confirmed he had experienced a transient ischemic attack. Further evaluation found severe narrowing in one of the arteries supplying blood to his brain. Because doctors identified the problem early, they were able to begin treatment to reduce his risk of a major stroke. Robert often says the strangest part was how normal he otherwise felt. He expected a stroke warning to be dramatic. Instead, it arrived quietly. That's often the reality. The body doesn't always announce danger with pain. Sometimes it simply changes the way the world feels against your skin. There are also situations where numbness develops alongside other subtle symptoms that are easy to overlook. Perhaps someone suddenly struggles to button a shirt not because their fingers are weak, but because they can't accurately feel the buttons. Maybe they keep dropping coins while paying at the grocery store. Perhaps lipstick goes on unevenly because one side of the lips feels different. Someone shaving may notice one side of the face no longer provides the usual sensation against the razor. Another person may suddenly find it difficult to judge the temperature of bath water with one hand. These aren't merely inconveniences. They may represent changes in the brain's ability to interpret sensory information. Even walking can feel different, not because the muscles have failed, but because the brain relies on sensation from the feet to maintain balance. Every step depends on thousands of tiny signals traveling upward from the soles of your feet. They tell your brain where your body is in space. If those messages become distorted, walking may suddenly feel uncertain. Some people describe it as walking on thick carpet. Others say the ground no longer feels familiar. Again, these sensations deserve attention when they appear suddenly and affect one side. It's also worth understanding why speed matters so much. Many strokes are caused by a blood clot blocking an artery in the brain. Modern medicine has treatments that may restore blood flow in carefully selected patients, but these treatments work best when people seek medical care immediately. Waiting to see if it gets better tomorrow can mean missing the opportunity to protect brain tissue that might still be saved. This is why healthcare professionals emphasize recognizing symptoms early, rather than trying to diagnose yourself at home. Your responsibility isn't to determine whether you're having a stroke. Your responsibility is to recognize that something is seriously wrong and seek emergency care without delay. Doctors, imaging studies, and emergency evaluations exist for that reason. It's always better to discover the cause is less serious than to miss the early stages of something life-threatening. As we grow older, it's also important to recognize that age itself increases stroke risk. That doesn't mean a stroke is inevitable. Far from it. Many people live long, active lives without ever experiencing one. But conditions that become more common with age can increase the likelihood of problems affecting blood flow to the brain. High blood pressure, diabetes, high cholesterol, smoking, irregular heart rhythms such as atrial fibrillation, previous strokes, or transient ischemic attacks. Each of these deserves careful attention because protecting blood vessels also protects the brain. Think of your arteries as the highways supplying every neighborhood of your brain. Healthy highways keep traffic moving. Damaged highways increase the chance of dangerous blockages. The encouraging news is that many stroke risk factors can be improved. Keeping blood pressure under good control, managing blood sugar, taking prescribed medications consistently, remaining physically active within your abilities, eating a balanced diet rich in vegetables, fruits, whole grains, legumes, healthy fats, and lean sources of protein, avoiding tobacco, limiting excessive alcohol, getting regular medical checkups. These habits don't guarantee prevention, but together, they help create healthier blood vessels and support long-term brain health. Just as importantly, they provide opportunities for healthcare professionals to identify problems before symptoms ever appear. There's another point I'd like you to remember. Not every episode of numbness is caused by a stroke. There are many other possible explanations: peripheral nerve disorders, vitamin deficiencies, certain medications, migraine with aura, multiple sclerosis, problems affecting the spinal cord. Even anxiety can sometimes produce unusual sensations. But here's the key difference. Those possibilities should be sorted out by medical professionals, not by guesswork at home. When numbness appears suddenly on one side of the body, especially involving the face, arm, or leg, stroke must remain high on the list until proven otherwise. That approach saves lives. It isn't about creating fear. It's about respecting one of the brain's most important warning signals. Because the brain rarely sends unnecessary alarms. When it suddenly changes the way half your body feels, it's asking for attention, and that request deserves to be taken seriously. Before we finish today, I'd like to leave you with a simple way to think about sudden one-sided numbness. Don't ask yourself only one question: can I still move? Instead, ask a better question: has one entire side of my body suddenly started feeling different? That small shift in thinking could make all the difference. Our brains depend on more than movement. They depend on sensation to help us interact with the world. Every handshake, every warm cup of tea, every grandchild's hug, every breeze on your face. Your brain quietly interprets thousands of sensory messages every second without asking for your attention. When that interpretation suddenly changes, it's rarely something to ignore. There's a helpful checklist that emergency physicians often encourage the public to remember. It's known as F.A.S.T. Face. Ask the person to smile. Does one side of the face droop? A. Arms. Ask them to raise both arms. Does one drift downward or feel unusually different? S. Speech. Is speech slurred, confused, or difficult to understand? T. Time. If any of these signs appear suddenly, call your local emergency medical services immediately. Time is critical. One-sided numbness isn't included in every version of this memory aid, but many healthcare professionals consider it another important warning sign, especially when it appears suddenly and has no obvious explanation. If sudden numbness is accompanied by facial drooping, weakness, trouble speaking, loss of vision, severe dizziness, difficulty walking, or a sudden, unusually severe headache, treat it as a medical emergency. Do not drive yourself if you can avoid it. Call emergency services. The sooner trained medical professionals begin evaluating what's happening, the better the chances of protecting brain tissue if a stroke is occurring. I also want to speak to family members and caregivers for a moment. Sometimes the person experiencing numbness minimizes it. They don't want to inconvenience anyone. They don't want to make a fuss. They may say, "It's probably nothing. I'll wait until tomorrow. I don't want to waste the doctor's time." Those reactions are understandable. But when it comes to sudden neurological symptoms, waiting is the greater risk. If someone you love suddenly tells you that one side of their face, arm, or leg feels numb or just doesn't feel right, take them seriously. You don't have to prove they're having a stroke before seeking help. You simply need to recognize that the symptom deserves urgent evaluation. I've met many stroke survivors over the years. One thing they often have in common is not that they ignored severe pain, but that they ignored something subtle. A hand that felt strange, a cheek that felt different, a foot that no longer sensed the floor normally. Looking back, many say they wish they had recognized those early clues for what they were. Fortunately, I've also met people who acted quickly. They noticed an unusual sensation, sought immediate medical care, and received treatment before more serious damage occurred. Their stories remind us why awareness matters. Knowledge doesn't prevent every stroke, but it can help people respond faster. And sometimes, faster response changes everything. If there's one message I'd like you to remember after today's conversation, it's this. Your skin may be where you notice the problem, but sudden numbness affecting one side of the body is often a message from the brain, not simply a problem with the skin or a minor nerve irritation. Your body has an extraordinary way of communicating when something is wrong. It doesn't always use pain. Sometimes it uses silence. Sometimes it changes sensation. Sometimes it whispers before it shouts. Learning to recognize those whispers is one of the most valuable health skills any of us can develop. It isn't about becoming anxious over every unusual feeling. It's about knowing the difference between a symptom that can wait and one that deserves immediate attention. That knowledge empowers you. It also protects the people you care about. Take a moment today to share what you've learned with someone you love. A spouse, a sibling, a friend, a neighbor. You never know whose life might be changed because they recognized a symptom they would otherwise have dismissed. And I'd love to hear from you. How old are you today? And had you ever heard that sudden one-sided numbness could be an early warning sign of a stroke? Share your thoughts or experiences in the comments below. Your story may help someone else recognize an important symptom and seek care in time. Until next time, continue paying attention to the quiet signals your body sends. They are often wiser than we realize. Stay sharp and keep with me. I will see you in the next video.